Today's part of our Lunch and Learn programme, which is hosted really by our fantastic ICB here in Lincolnshire, and specifically Chloe oversees it. Just to remind you all that we have a chat process, so if there is opportunities to ask questions towards the end, if you don't want to use chat and you just want to go full pelt and speak, please just use the emoji at the top which says raise, which is raising your hands, and then we'll come to you as quick as possible. What tends to those who've never been to Lunch and Learn before, this is just 1 hour at all. We ask an expert, so Abby, you're our expert in a certain subject, and of which we then we ask the expert to do a presentation, of which we will share those presentations with you as well. And the example is that we get a conversation, but we also have a meaningful conversation and meaningful questions. This is an opportunity, it's a safe space, so any questions is not a silly question. So we're all here to listen, we're all here to learn as well. And that is from me. Point out, Chloe, anything from you before we invite Abby to introduce herself?
No, thank you. Just thank you so much, Abby and Louise, for your support with this. I'll be sharing my screen now, Mark, if that's all right, and I'll keep quiet.
Well, that'll be a first, Chloe.
No.
So, Abby, do you want to come and introduce yourself, and then I think Chloe's looking after your slides,
I think so. My name's Abby. I'm the clinical team lead for the Specialist Palliative Care Team in the community. I'm here to talk about the education strategy today, which is a system-wide offer around palliative and end-of-life education, just to try and sort of standardise how we deliver it. And my friend Louise is also here to talk about the palliative strategy for Lincolnshire.
Thanks, Abby. So I'm Louise Johnson. I'm head of integrated community partnerships, but I've got a county in South Lincolnshire, but I've got a county-wide focus around palliative and end-of-life care. So as obviously education and training is a golden thread throughout a palliative and end-of-life strategy in Lincolnshire, Abby and I just thought it would be helpful just to give a very brief overview of the strategy in Lincolnshire. What we can do is share the link as well to the strategy, so you can read it in much more detail if that's helpful to you. So if I kick us off, if that's okay, if you wouldn't mind moving us on, Chloe, that would be great. So it's a 5-year strategy, as you can see on here, and it's really based on what people told us, really. So that's patients, families, staff, working in community and specialist palliative and end-of-life care services. About how they experienced care. So some of those comments were around poor patient and carer experience, delays in care provision, prescriptive care, difficulties of navigating overly complex processes with referral and triage confusing and clunky, poor coordination and communication between teams, inconsistent access to specialist palliative care resources, stretched resources, and especially at times of high demand, lack of support for staff to develop and maintain skills, lack of identification and recognition of deterioration, teams being fragmented. And so what we wanted to do was obviously work together, and we've been doing that now for a number of years, particularly COVID was, I guess, where we really started to see the benefit in working together as system partners to look at palliative and end-of-life care. And that's really where the strategy was kind of sort of developed, really. It's based on clinical evidence and national guidance, and also based on obviously our local needs within Lincolnshire. The system commitment to integrated care, and obviously if you kind of have had a look in the 10-year plan for the NHS, neighbourhood health is a really key area of focus. So this really aligns us really well to that national strategy. So if we could move on, Chloe, that'd be great. So I do recognise we've got lots of knowledge and skills in the room today, so I don't want to go into lots of detail about palliative and end-of-life care, but just to give a very brief sort of definition, to both. So palliative care is about improving the quality of life for anyone facing a life-limiting condition. It includes both physical, emotional, social and spiritual care, as well as practical support for the patient, their families and their caregivers, especially as they approach the last year or years of their life. And the ethos of the strategy is all about living well until you die, focused on improving the quality of life for people and those important to them who are facing challenges associated with life-limiting illnesses. So whether that's physical, psychological, social or spiritual, and it's palliative care is often for a prolonged period from diagnosis. End of life is when we're talking around that last year of somebody's life. So it's associated with that care at a time that is likely to be that person's last year of life. And it focuses much more on ensuring comfort and maintaining dignity for that person. If we could move on, Chloe, please. So this really illustrates that a person's palliative and end-of-life care isn't delivered by a single core team. It's about us all working together. So on the right-hand side of the screen, as you're looking at it, the triangle or the pyramid really tries to illustrate what we're trying to achieve here in Lincolnshire. So what it's saying is that the level of involvement from each service area will fluctuate throughout a person's journey, which is not a stepped approach, but a flexible model that responds to need. So each tier of provision is dependent upon the others to ensure a holistic approach to the health, wellbeing, emotional, social and spiritual needs of the person and those important to them. We know that the majority of care will be delivered through core services, so that's care homes, primary care and that wider neighbourhood, but at times people will need support from other parts of the system. So palliative care is around population based, with every healthcare and social care professional having a role to play. For this strategy, it's broken down, as you can see, into these three domains, so integrated, specialist, core and enhanced. So core is, as I say, where the majority of care will take place. So our primary care teams, our community nursing teams, our care homes, our urgent and emergency services, social care and that wider neighbourhood. Enhanced is neither health or social care. It's often funded by charities and not commissioned. So things like our St Barnabas Wellbeing Service is an example of that. And then our integrated specialist service. So that this could be inpatient or it could be community based, and it includes our hospices, dementia services, specialist palliative care teams, Marie Curie, etc. And they're usually an add-on to our core services. So they've got that real specialist knowledge and skills, which as core services we'll tap into at times for certain people that we're supporting. So each area, as the diagram explains, is interlinked and dependent on the others to provide a holistic, person-centred approach. So the next slide, please, Chloe. So our vision for palliative and end-of-life care in Lincolnshire is to improve the quality of, so I just close that down, of palliative and end-of-life care in Lincolnshire using an integrated, personalised approach. It's to identify all people deteriorating from a life-limiting condition at the earliest possible stage through working with our communities. As people working in our care homes and care sector, you'll know your residents better than anyone, and you're really our key to identifying those people at a really early stage. We know that if we identify people in the last weeks or days of life, it gives no time for the person to plan what's important to them. It gives no time for their family and loved ones to prepare, and it puts added pressure on our services with care when care is delivered at point of crisis. So Our vision is around palliative care services being coordinated and delivered within primary care networks, which are groups of GPs working together based on a wider population health need, and it's to provide the best possible support for people. So palliative and end-of-life care services will work together and operate within a consistent framework and at the most appropriate level and setting to meet population health needs and provide equity of access to high quality personalised care across the county. The provision of palliative and end-of-life care will form an important part of a wider framework of person-centred care across Lincolnshire. So if you haven't seen that, it's All About People website in Lincolnshire will give you more details around that. Next slide, please. So our 6 objectives are here. I don't intend to read those out, as Mark's already said. We'll be sharing these slides afterwards, and we'll also share the link to the strategy so you can have a look at that. But really we're focusing on improving that recognition so that we can then have longer to prepare for the needs of those people that and those that are important to them within Lincolnshire. So next slide please, Chloe. So this is our delivery model for integrated palliative and end-of-life care. So this has been co-designed, as I said, with partners and stakeholders across Lincolnshire, and it's these 5 pillars of core, enhance. We've got a single point of access which is now available 24/7 for advice, coordination, trade communication. Integrated specialist palliative care with a wide role in education, research and audit, all working as an integrated workforce with staff being supported with education to attain and maintain best practice standards. It's got a strong focus on the needs of individuals rooted in primary care through local integrated MDTs, including all assets within our neighbourhood teams, with access to the specialist palliative care when it's needed. So working together with communities to identify those people deteriorating from a life-limiting condition at the earliest possible stage and provide high quality care. We want to coordinate care and services, which puts the person really at the centre of our decision making. And it's an important part of a wider framework, as I say, of that personalisation programme. So please go and have a look at that if you haven't seen it already or you're not connected to that. And the vision is that people will be identified, their care needs assessed and met, aligned to palliative care specific patient outcome measures. So things like the gold standard framework, and offered conversations about what matters to them and those important to them, and includes advanced and escalatory care planning. So I hope that's helpful, and I'll hand over to Abby now. Thank you.
Thank you. Do you want to do questions for that part at the end as well, Chloe, or do you want to do questions for that now? Do you want to do it at the end?
It probably would be better if we move through yours and then take all together, if that's all right, Abby. Yeah.
Okie dokie. Yeah. So building on then from what Louise has said, part of the reason for building this education strategy was that a lot of the things that were identified from patients and relatives around sort of lack of coordination of care, lack of recognising deterioration, all those sorts of things can be improved through education and training. So we've put this strategy together. It is based on the national framework for palliative and end-of-life care. So I haven't just plucked it out the air and made it up. So what we'll do is just go through the different tiers briefly today, and then my ask, I suppose, from you guys would be to be my guinea pigs in testing this out to see actually, does it work? Is there anything that people think would be beneficial that we've maybe missed out? Is there things in there that maybe they don't feel are that useful? So we'll go through the tiers briefly, and then I can answer any questions on it. And then, yeah, if you could have a go at playing around with it, I would be very grateful. So next slide, Chloe, thank you. So why have we put this together? So it's based on the ambitions framework around palliative and end-of-life care to make sure that we get it right for patients every time, and we can do that through making sure our staff are competent and confident in providing palliative and end-of-life care. The other thing that we have put into the strategy is some core definitions that will standardise how we discuss and talk about palliative care across the system. Because I think what happens is someone might say palliative care, someone might say end of life. They think they're talking about the same thing, but they're very different sort of definitions. So we've provided some standardized definitions that should help to clarify what a clinician's talking about along the journey. Next slide, please. So we've done 3 tiers. So tier 1 is based around sort of, I would say, like the non-clinical staff, so maybe your reception staff, admin staff, housekeepers, so those people that aren't going to have sort of direct clinical contact with patients, but it's still really important that they feel comfortable talking to patients that might be dying or talking to relatives of patients. You know, we all know the housekeepers on hospital wards are usually the ones that everyone talks to and know what's going on. So I'm sure it's probably the same in care homes. You'll have people that maybe aren't direct clinical that patients and relatives will want to talk to. So it's making sure we've given them the education to feel confident to talk to them. And then tier 1 will build into tier 2. So tier 2 is looking at your clinical staff, maybe those that have some contact with patients but aren't dealing with it on a daily basis. And then tier 3 is clinical staff that are very much involved in daily contact with patients and relatives at end of life. So that's sort of how we've built the programme. Next slide, please. So that sort of explains the different tiers, like the general awareness through to the in-depth knowledge of each tier. And again, just kind of gives practical advice and guidance to give that confidence. So that's just that one. Next one, please. I'm going to whiz through these. I talk really quick. Sorry. So the first tier, the topics that we looked at are patient-centred care, communication, support for carers, care after death, and staff wellbeing. And those are the core topics that will run through all 3 tiers, and then tier 2 and 3 have some additional learning with them as well. But we felt that these 5 are the core topics that everybody needs to have some education and training on, just to give them that confidence. And we put staff wellbeing in there because working with palliative and end-of-life patients can be really emotionally challenging for some people. So it's how can we look after our staff so that they can then look after patients and relatives. So we thought it was really important that we put that in there. Next slide. So this is just building on it again. So in addition to the first 5, we've added in care planning, recognition of deterioration, some symptom management, and also involving patients and carers on how to navigate services, because it's quite difficult sometimes. Even as a healthcare professional, I think sometimes the Lincolnshire system is really difficult to navigate. So it must be even harder for our patients and relatives to try and navigate some of those services. So within this strategy, we have done links to referral criteria and to the different services out there that we can then signpost people to. Next slide. And then this is the highest tier, where we're looking at that symptom management and delving into slightly more complicated scenarios with patients, some maybe ethical decisions that we might come across that we need a bit of confidence and competence looking at, and also then how to communicate with your other service providers. So if you need to talk to hospitals, GP surgeries, community nurses, so it's trying to bring all the system together and how to communicate with each other. Next slide. So I think we've just discussed that. So that gives you your definitions of and why they matter, so that we're all speaking the same language. We're all singing off the same hymn sheet. Next slide. So hopefully by the end of the strategy, by the end of a lot of it is reading and watching videos. I haven't put PowerPoints in there because sometimes I feel like death by PowerPoint, you don't necessarily take the information in. There is the links to the respect training as well, so you get some really good standardized respect training, and I've put the SBAR template in there so that when for example, if you have to ring EMAS or Lives or someone, you can then really sort of explain what it is that you're wanting them to do when you're ringing them. It gives you like a template to hand over the patient essentially. And then I think that's it. Oh, bereavement as well. So there's a link to Tell Me Once, so that will then help families to know where they need to go when someone has died, in terms of medical examiners, death certificates, those sorts of things. So all of that information is in there. Next slide. So hopefully in doing the education, it should help to give staff confidence and competence to provide palliative and end-of-life care. It should hopefully improve patient outcomes and give patients a better experience, because I think that was something that was it was expressed quite a lot in one of the Voices surveys, was that patients felt they weren't particularly getting a good experience at end of life. It gives a consistent message and a consistent learning platform across the whole system as well. So everybody's kind of providing care to a set standard, and should help include like equitable access to services as well, and equitable access to care. Next slide, please. Is that it? Oh, okay. So on this slide, if you click, you're right. I don't know if you want to click it, Chloe, where it says click here.
Oh, it might die.
It
Bear
might.
with me. That might. Sorry, poor
hopefully that
choice.
should,
Oh,
it won't.
oh.
Hopefully that should take you through to the home page of the package.
Can I stop sharing a minute, Abby?
Yeah.
Sorry to interrupt, because I'll
No,
bring
that's
up my
fine.
other screen. Just bear with me a moment.
It's an online resource. It's openly available and free through the ICB website. And you can just literally click through. It's the tile presentation. So you click a tile and it takes you to the learning. So it should be fairly easy to sort of navigate through. But I think there is also a PDF downloadable version that you can click through as well. So 2 options. And it
Is
just
that
then
showing now, Abby? Yeah, great.
So if you click along for me, Chloe, just on the live one.
Oh, sorry. If I click on what? Sorry.
Yeah. If you just click on the screen, it should take you
right.
anywhere. It should just take you to the next slide.
Oh, brilliant. Yeah.
And if you go to where it goes to tier 1, so keep going. Yeah. So if you click, keep going. There we go. So if you click on introduction or outcomes of training, any of those, you put and it takes you straight to the material. So you click on the button and it brings it straight up. So it's quite easy to navigate. And if you want to kind of move about, you can just click the button that you want and it takes you to the page that you want to look at.
Sorry, I'm not very good, not very good, but it's from a complete technophobe. This is brilliant though, isn't it? It's really intuitive, isn't it? That's
Magda
great. Sorry, I'll go back to you. I'll go back to your presentation. Bear with me, Abby. Sorry. Oh, I'm no good at being your Debbie McGee here, Abby. Blimmin' heck.
I think that was near the end.
Is that near the end? Yeah. Okay.
I think so. Yeah. That was just sort of those slides I was explaining where it's all come from. So it's come from the ambitions framework and the national framework for end of life care, the education that they've put on, and it links to the palliative end of life strategy in terms of ensuring that everybody's getting the same access to education and training across the system. So that's it. Has anybody got any questions? I know I talk really fast. Sorry.
Okay, shall I stop sharing there, Abby? So the links that you've provided in your presentation, well, we'll share the presentation and the links, and it's a really great website, isn't it? It's so helpful to navigate. And
it is really easy to navigate.
It's really
really click through, and you can kind of click on something and then move on to the next bit if you want to, or come out and go back at another time. So it's very much picking it up as and when you've got time, as opposed to look at it.
Yeah, thank you very much, Abby. Mark, you happy to open up for any questions?
Yeah. So this is the opportunity, ladies and gents, to ask our experts. Like I say, you can do that by raise your hand or write something in chat.
stunned everyone into silence.
Louise.
Just thinking around how we want people to feed back, I suppose, around the training, because obviously it is new, isn't it? And we are keen for people to test it out. I'm just wondering whether we want to ask Magda to maybe do a feedback form for people that have used it and how they would find it. I don't know. I'd be curious as whether we can say that we'll ask Mag to do it because she's not here, so that's fine. We can.
No, I
we
can take
do
that back. Yeah.
But I just wonder if that would be helpful for people, because I guess if there are some things that we can improve, or things that are really positive that people really like, if we get that feedback, we can respond to it.
Yeah, I'll pick that up with Magda. We can ask
I mean,
Magda to do that. Yeah.
I guess would the people on the call, would they feel that was helpful? Be happy to do that?
I think if we can get it into Sway or something like that, or on
That's when I'm going to put myself on mute, Mark, because like you're talking another language to me. So
or put it through a link survey.
Yeah.
Say on Microsoft, rather than actually having something paper based. I think if you've got that, so therefore that can be done really quickly, and you've got that data straight away. We have a couple of questions. One is, how do we access tier 1, 2 and 3 training, please?
So if Chloe shares the presentations, the link to the training is in the presentation, so you can click on the link and it should take you straight through to the website.
That's simple. Yeah. I'll send the presentation through to you now, Mark, and maybe that can go out as soon as your team are ready to share that.
Yeah, we can get that out. I can get my team send that out in the next hour.
Could I just ask a real basic question? So this is free to anybody. The training is free to system partners. Yeah, just to ask an obvious question. So there's no charge for any of this. This is around the benefits of our population, and for all, open to all. Yeah. Okay.
And it's a strategy, doesn't it? Sorry, that education's key, isn't it, throughout our strategy for palliative and end of life. So we value all people working across our health and care system, to try and get that standardisation of what we expect, really. So yeah,
I think that's a good point, Louise, because we've got on the call today, we've got a couple of home care providers as well, and I think it's important that actually that is the message. It's actually across the whole system, and this is transferable as well, I think, isn't it? So therefore, whether you work in health or in social care, or migrate across the two, or migrate within one side of it, it's actually a transferable knowledge, of which it will have the same impact on the people you care for.
Yeah,
right.
And as I say, if there is something that people think, oh my God, this is terrible, please also feed that back.
So come on, guys, have we got some questions for our experts here? So the question is it'd be interesting for some of you, is there a gap? Are you currently covered in the process of having access to this level of really good resources to support the narrative on palliative care and end of life? I know I get quite a few people who will contact me asking, can we send some resources? And this is, to me, is just the key to unlock a big door.
Mark, I wonder as well, on the presentation, I don't know how many people have accessed the website for Lincolnshire. So we've got an end of life care website, ERLC. I don't know whether people have used that before. I know Abby's included that within the presentation. So again, if you haven't seen that, there's lots of resources. There's some podcasts in there. So things, I can't think off the top of my head, like Respect. There's some podcasts and things like that. So if you're not familiar with it, I would certainly recommend that as another area of resource that you could link into.
We put a link in the chat, Mark, and we'll also share that again with the slides that we send out, Mark. I just wonder if it's worth mentioning as well, in one of your last slides, Abby, there was reference to the care after death policy, the care after death work, and we're just in the process of putting together another lunch and learn that might support this one around the care after death policy, working in Magella, and around the verification of death, a bit more awareness around that. So we're working with the police and EMAS colleagues and the coroner's office as well. And that might just build on a lot of what you guys have shared today, really, because there's maybe a bit of myth busting. So we're just in the process of preparing that session, Mark, and we'll work on a date around that. But I think that will be quite a useful follow-on from this session as well, if that would be of use to people.
Thanks, Chloe, for that. I think definitely would be. I think any help is helpful. Yeah, quite a few people have said yes, so that's good news.
Okay.
I was worried chat had disappeared, but you know, if people are using it. Okay. First of all, both Abby and Louise for giving up your time. I think it's an important, and I'm sure I'm surprised we'll probably get some more sessions on this early in the new year. I think, Chloe, I think it's a very poignant and we're subject, but it's probably at a greater stage where we've got some more information coming both ways. Anything from you, Chloe?
No, it was thank you all for joining. Thanks again to Abby and Louise. We'll share it again, and we will follow this on with the verification of death and a bit more information, because it particularly around the verifying death in a care home, just doing a bit of myth busting. Maybe we can weave in a bit about implementing the strategy. So if you've got any thoughts or questions outside of this session, please don't hesitate to contact Mark and myself, and I'm sure Abby and Louise will be happy to receive any queries around what we've discussed today. So thank you. Keep us close, and we'll work through any queries that you've got.
And our next lunch and learn is on the, remind me, Chloe, looking at it.
I think that we were looking at, oh gosh, put me on the spot now. What did we say? There was it the 27th of November we were looking at, and we were looking at managing respiratory illness, hopefully working with our community respiratory team around that one. So yeah, dates will be coming out shortly, won't they, Mark?
Yes, thank you very much.
Okay.
Thank you very much. Right, again, big thank you to our guest speakers. Amazing, giving them the time and supporting this. If we can support this as best as possible, I think this is down to you guys as providers, is to engage, to road test it, and feedback. The most important is the feedback, I suspect, from Louise and Abby. They want the feedback as well. And I think it's important for social care have a voice in this, and as providers, you have a voice. Louise.
To get the feedback from all people involved in the different tiers as well. So as Abby said, you know, your housekeepers, your cooks, etc., that may have that contact, you know, what it was like for them as well. So not just, you know, so we get a whole range of what that experience has been like, I think would be helpful.
What about family? What about families and friends who are party to that individual's care package? Do you want that, Louise?
I think this is for paid staff, Abby.
Is it paid?
So tier 1 is at one point we were looking at whether tier 1 was for like general public as well. I think we decided in the end to keep it at the moment for health and social care professionals. I suppose if one of those is a family member that maybe is looking after or has a family member somewhere else that's being looked after, it might be worth feeding back from that angle. But yeah, it's aimed at professionals at the moment.
Okay, that's fine. Thanks for clarity to that. Okay, fine. All right then, ladies and gents, if that's a big thank you to all, and that is the end of the session, and I will stop filming.